Welcome to the Healthy, Wealthy, and Wise podcast with Dr. William Choctaw. In this episode, Dr. Choctaw will continue his Leadership Masterclass series by covering healthcare's quality revolution. He'll explore a number of factors that are driving this revolution, factors that include the latest developments in healthcare quality and how it has changed the landscape of healthcare delivery. The Affordable Care Act, patient-centered care, high reliability organizations, Lean Six Sigma, and medical malpractice. Dr. Choctaw will also explore data and analytics and how they are used and applied to help improve healthcare. So whether you are a healthcare practitioner, a healthcare professional, a patient, or just a consumer of good information, this podcast episode is for you. Join us now as we explore healthcare's quality revolution and discover how we can work together to help improve the quality of healthcare delivery for everyone. So let's get started. Here's Dr. William Choctaw.
Good morning. I'm absolutely delighted to be here, and I welcome you to the Masterclass number 5. Masterclass number 5. Today we're going to talk about leadership in terms of healthcare's quality revolution. Quality revolution. I believe that their life is about being of service to others. I believe knowledge is power. I believe leaders can change the world. You notice I always start off with the same beliefs, and these are my beliefs. And you may say, well, Dr. Choctaw, why is it you keep talking about what you believe? I do this for two reasons. One is to emphasize the important point that we started with the very first masterclass about talking about the brain. That is what you believe that affects how you think, and it is how you think that affects how you act. And so it's always important for us to go back individually to our individual belief and make sure that they're in sync with where we want to be and where we think life is going for us. If they are not, then change them, but to always be aware of them. For the last 5 weeks, I've asked you to think like doctors as we talk about this masterclass. And as Jesse mentioned earlier, we're going to deal with both medicine and law as we talk about healthcare. One of the things that I learned, well, let me back up. I graduated from medical school in 1973. I graduated from law school in 1998. 25-year difference. And one of the things that I learned is the difference between doctors and lawyers. And I did not know this before. We doctors think in terms of black and white. Either my patient has acute appendicitis or my patient does not have acute appendicitis. Either my patient's had a heart attack or my patient has not had a heart attack. Doctors like to have exactness. They like to be specific. And we're uncomfortable when we aren't able to be specific. To lawyers, there is no black and white. Think about that. Doctors think in terms of black and white. Lawyers, there is no black and white. Lawyers think in terms of grayness. Everything is gray. It's how you use the facts to make it a little dark or a little light. So it's one of the reasons why when a doctor is talking to a lawyer, they many times there's a conflict because the doctor is saying, but I saved his life, so why in the world is he suing me for malpractice? The lawyer is saying, I don't care that you saved his life. You violated section 1 of XYZ, blah, 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 blah. Therefore, you're going to be liable for malpractice. So it's a different welcome. So it's a difference in the way we think. Doctors think in terms of black and white. Lawyers think in terms of grayness. And I'm definitely a black and white guy in terms of how I think and wanting exactness and this and that. But what I have learned as I've gotten older is that the world is probably gray. Most people probably do think in terms of in terms of gray. But we'll go over that a little bit more as we move along. If you remember, this is your computer. Some people call it a cell phone. Some people call it a smartphone. I call it an academic hand computer because you're in the master class and you're exceptional compared to other students. You're expected to use your academic hand computer and look up stuff all the time. Anytime you have a question, about anything, maybe a couple of times a day, you should go to your academic hand computer and put into the browser, what is the meaning of artificial intelligence, blah, 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 blah. So I always want to make sure to remind you about that. As always, I always like to include an outline. And the purpose of the outline is to let you know what we're going to talk about. That's one purpose. Second purpose of the outline is to let you know when we're just about done. So I know you're one of those busy people, and God bless you, you're taking time out of your Saturday to be here with us for an hour. So we're going to talk about change, and we always talk about change to some extent. We're going to talk about the Affordable Care Act, or Obamacare, as you probably heard it, because that has been fundamental to the change in healthcare. We're going to talk about something called HCAHPS. This is a survey that the government started doing probably about 20 years ago, 15, 20 years ago, of patients to help to evaluate doctors and hospitals. And we'll go into detail about that. We'll mention about high reliable organizations. This is where hospitals want to be. High reliable organizations are those organizations that are trying to get to zero patient harm. Zero patient harm. One of the codes that we take as physicians, in essence, is to first do no harm. You may not help, but you don't want to harm anybody. So the first thing you want to do is not to harm anybody. We'll mention briefly about Lean Six Sigma just as a process of excellence, and then we'll end with medical malpractice. So when we get to medical malpractice, you know I'm just about done, okay? All right, here we go. Quality revolution. One of the things you hear people talk about a lot in healthcare is quality. In other words, the essence of what you do to a person, or are you giving them the best type of care as compared to less best type of care? And one of the truisms that I've learned that I want to share with you, and I heard somebody say this to me a long time ago: if you can control the dictionary, you can rule the world. Think about that. If you can control the dictionary, you can rule the world. Because see, if I control the dictionary, things mean whatever I say they mean. Black means white, up means down, in means out, because I control the dictionary, right? So you want to be very, very careful when you hear people talk about whatever they're talking about, and ask yourself, who controls the dictionary? Who decides what's good? Who decides what's high quality, what's poor quality? Who makes that decision? And how did they get that ability to be able to do that? Another fundamental principle that we'll address multiple times today is healthcare. Is healthcare a privilege, or is it a right? Do you have a right to quality healthcare, or is it a privilege that you've been blessed with being able to experience? More and more now, and I'm in the category that believes that healthcare is a fundamental right. I do not care where you are. I do not care what you do. I do not care what you look like. I do not care what your politics are. I do not care whether you're a follower of Martin Luther King or you're the imperial wizard of the Ku Klux Klan. If I am your surgeon, I'm going to give you the very best care. And it does not matter to me. I'm not even going to ask you about your politics. Does that make sense? Because as a physician, my job is not to judge you. So I don't judge. I don't judge. Now, that's a little different from the way I grew up, where, you do judge. I look at him and I judge this and I judge that. But as a physician, my job is not to say, well, he's wearing a black watch, therefore ABC, or he's wearing a blue jacket, therefore I am a physician. And my job is to give you the best care possible. And that is irrespective of what you believe and who you are. Now, everybody does not believe that. But I think it's fair to say that most in society are moving toward the fact that healthcare is a right. It is not a privilege. I don't care what your citizenship is. I don't care where you were born. If you land in my hospital on my operating room table, I'm going to give you the very best care possible. And all that other stuff does not matter to me. It is not relevant to the quality of care that I give you. And this is where we're trying to get doctors and nurses and hospitals to get to today. One of the other basic principles that the federal government figured out some years ago is it pays most of the money in this country for healthcare. The federal government, Washington, D.C., pays most of the money for healthcare in this country. So the government said, if I pay most of the money, I think I should control that dictionary, right? If you can't do it without me paying you, and you rely on me to pay you, then I can decide what's what. And so then the government said, I will decide or help to decide what quality is. No, Dr. Choctaw, we're not going to go by your definition because I'm paying you, right? And so you can have your thoughts. That's good. I'll listen to your opinion. But at the end of the day, it is my responsibility. So I'm going to tell you what my expectations of you are. Hospital X, I'm going to tell you what my expectations of you are. Okay. One of the big ways this occurred in this country, and many of you have heard about this and you sort of know about it, but it may not have been obvious to you at the time, is the Affordable Care Act. And you hear one party in this country saying they're going to repeal it, and they promise they're going to repeal it, they're going to get rid of it. And the other party in this country said it's the best thing that's ever happened to healthcare in the last 20 years. And some even call it Obamacare because it was President Obama who actually pushed it through. It's similar to the 1950s where Medicare was first adopted. Medicare did not exist until the 1950s. What does Medicare do? Medicare helps to ensure quality care for elderly patients in this country. Because when you're elderly, you probably no longer work, and the older you get, the more and more and more medical conditions you're going to develop, just the way it is. Okay. So the government decides, well, if you've worked hard all your life or you've lived a long time, you should not be denied health care just because you're over 65 years of age. So Medicare says, we're going to help pay for your health care. And that's why we have Medicare. And I might add, there's some people who objected to that in the 1950s. No. That's socialized medicine. People ought to work for their health care. For instance, I've been working for the last 50 years. I'm 75 years old. I'm not going to work anymore. But still, it depends on whether you believe that healthcare is a right or privilege. Should it only be for certain people who have a certain amount of income, or have a certain amount of blah, 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 or live in a certain zip code? Or should it be for everybody? Because it's a God-given right to human beings, and it should not matter who you are or what you look like. But that's the fundamental argument. That's the fundamental argument. And you hear it play out all the time, every day. Three things, very briefly, that the Affordable Care Act did, or does, because it's still with us. The other party was not able to repeal it. They keep trying, but they keep failing. One, it covered more people. In other words, it paid for care for more people, i.e. single parent, 3 to 4 children, may not have a job, stays on welfare or something like that. How do you pay for, and if you have a sick child, how do you pay for those expenses? So the Affordable Care Act helps to pay for that. It controls costs. There's some who believe, well, you pay whatever I charge. Well, not really if I don't control the dictionary, okay? Because the person controls the dictionary says, no, Choctaw, you can't charge $1,000 for cutting a toenail. That just doesn't work. You can't do that. I know you may have house payments. Get a smaller house. Get a smaller house, okay? The other thing, and probably one of the most subtle, and I think one of the most profound things that Obamacare did back in 2010 is that it forced hospitals and doctors to go all electronic, forced us to use the computers, put down that pen and pencil, and it drove the industry crazy. I know nurses that quit at hospitals because they had to learn how to use a computer. And the nurse says, I want to be at the bedside. Doctors who said, well, I'm a doctor. I operate on people. I don't want to do all that paperwork. And the government said, you know what? I control the dictionary. I'm paying your salary. Quality is what I say it is. What I say it is. And quite honestly, my personal opinion, the government was correct. Because if you're doing the right thing, why is it a big deal for you? Okay? One of the other fundamental things about this whole change in the idea about quality healthcare is, let me do it with a hypothetical. And I'm sure I've said this before. When I graduated from medical school in the early 70s as a physician, we were told that we're in charge. We doctors, I mean, are in charge. People just do what we say in a hospital. And I think I mentioned, about how nurses used to stand when the doctor used to walk onto the ward and all that sort of stuff. But basically, the response to the thing was, yes, doctor. I said, do X. Yes, doctor. Do Y. Yes, doctor. No question, no blah, 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 none of that. And the government said, you know what? If you go and stay a couple of nights at the Ritz-Carlton, before you even get home, they will send you something that says, how was our service? Did you like it? Were you okay? Were there any problems? Would you come back again? Would you recommend us to your friends? Blah, blah, blah. What's my point? My point is that quality organizations are always interested in the opinion of the customer. Who is the customer in healthcare? Doctor's not the customer. Nurse is not the customer. Patient is the customer. And so one of the things that my last 7 to 8 years in full-time employment, run around the country trying to help, along with the Joint Commission, educate physicians at hospitals about quality care. A fundamental thing I would say it is no longer, doctor, about you. Used to be about you, 70s and 80s. This is now 2023, about the patient. It's about the patient. It's what the patient thinks. It's what the patient believes. It's what the patient feels. And so, in effect, this is what the government, who controls the dictionary, who pays the money, has adopted and said it's patient-centered care. So what do you do when something is patient-centered or customer-centered? The patient is your customer. You ask their opinion. So the government many years ago came up with something called HCAHPS, and that stands for Hospital Consumer Assessment of Healthcare Provider and Systems. What that means is hospital consumer assessment, patient, of healthcare providers, doctors and nurses, and hospitals and systems, healthcare delivery systems. So 2 weeks after the Medicare patient is discharged from hospital A, hospital will send a correspondence, a letter with a survey, and it will have 27 questions on it, only 27 questions. And the questions are in different areas. And I'll just deal with the question about doctor. The only 3 questions they ask the patient about doctor. And the concern here is zero patient harm. And the answers to the questions are either always, usually, sometimes, or never. Okay? All the patient has to do is fill in the circle that says always, usually, sometimes, or never. The 3 questions that they ask about doctors is, how often does your doctor treat you with courtesy and respect? Real basic question. How often did your doctor, when you were in the hospital ABC for 2 weeks, how often did your doctor treat you with courtesy and respect? Always, usually, sometimes, or never. And here's the deal. If the patient's answer is not always or usually, Medicare ignores the other 2 scores. They don't care about never and sometimes. It is 0. You get a 0 for that. The only thing they score are 4 for always, 3 for usually. That's all. Okay. Second question they ask the patient about the doctor. How often does your doctor listen to you? Real basic stuff. Doctor comes in making rounds. Good morning, Mr. Smith. How are you this morning? Mr. Smith says, oh, doctor, I had this horrible headache and my eyes have sort of been watering and my neck is sore. And says, okay, you have a nice day, Mr. Smith. God bless. And you go on to the next section. How often does your doctor listen to you? Real basic stuff, right? Third and final question they ask the patient, Medicare patient, in this survey they send out. How often does your doctor explain in ways that you can understand? How often does your doctor explain in ways that you can understand? One of my responsibilities I won't mention the name, but a small hospital in West Covina, California, is that I would try to educate the doctors about sitting when you make rounds. Doc comes in, morning, Mr. Jones, blah, 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 blah. Have a great day. Any questions? And is leaving the room. And usually when the doctor says, are there any questions, his hand is on the doorknob, right? Because he's going out the door. And do you know, and this is what I would explain to the doctor, because I learned this, most patients believe very strongly that doctors are extremely busy, number one. Number two, most patients are extremely respectful of physicians. They will not ask you a question if they think you're too busy to answer. They will not. And they can have a question. Oh my God, I've been waiting all night, and I want to make sure that I grab Dr. Choctaw this morning. And so what I tell the doctor, you've got to give them permission to ask you a question. And how do you do that? You say, uh, uh, "Thank you, Mr. Jones. Do you have any questions?" And you follow it up with one simple sentence. I have the time. That's all you have to do. So take your hand off the doorknob, put your hand by your side, and say, "Do you have any questions, Mrs. Smith? I have the time." When you say, "I have the time," now you're saying, okay, he's giving me permission to ask him a question. They will not ordinarily. They won't. 98%, 99% of the patients say, I do have this pain that I want to answer Doctor about, but Dr. Choctaw is so busy. He's so busy. I see him running up and down the place and this and that. And I'll be okay. I'll be okay. But it is our responsibility to go to the patient. The patient shouldn't have to try to figure out what to ask us. Our responsibility is, do you have any questions? Okay. So this is a huge change in healthcare, where it's basically top down, and you do what we say and you do the way I say it. I can remember when I would go on rounds and I'm wearing my little white pants as an intern, and then there's the middle resident and the senior resident, and then there's the professor in surgery at Yale. And the professor would walk into the patient who's going to have surgery, and he would look at her and he would say something like this: "Tomorrow morning, I'm going to take you to surgery at 7:30 in the morning, and I'm going to do a cholecystectomy. The operation will last approximately 2 hours and 45 minutes. You will have some discomfort. I will give you pain medication. You will be in the hospital maybe about 2 weeks." And then he'd walk out of the room. And patients say, "What? What did he say?" And what would happen was the resident would stop and say, "Mrs. Smith, do you have any questions? Professor Choctaw is so busy, but I'll ask you a question." And that's how we used to do it. That's how we used to do it. Hopefully, most of that changed, where we stop and we even tell the doc, sit in a chair by the bed. Some, if you feel comfortable, sit on the bedside. Some do that and say, "Do you have any questions?" Why? Because most communication is nonverbal. It is not what I say, it is what I do. So if I don't say I have the time, but if I sit on your bed, or if I pull up a chair beside your bed, I'm telling you, yeah, I got some minutes. Talk to me. Right? Very important. And so this is what's happening in healthcare now. Some hate this. Some physicians hate this. Some in healthcare hate this. But I think it's fair to say that the majority of us are moving in this direction. And this is one of my jobs, which I loved, among other things. One of the things that I have learned, like a lot of times doctors say, "Well, I practice in San Gabriel Valley and it is so diverse. You've got so many different ethnic groups and so many this and so many that. And I can't be responsible for making sure that everybody understands everything and understands me and whatever." And what I would do, what I would give like my little 60-minute lecture to the doc, I said, respect transcends all culture. You don't have to be an expert in Mandarin or Chinese or Tagalog, or Filipino, or on and on and on. Just be respectful. Be respectful. And how do you be respectful? Most communication is nonverbal. Read the room. You walk into a room, and father is the patient, mother is sitting beside him, and the adult kids are standing in the room. What do? One of the things you want to do is you speak to father, but you want to speak to mother. I used to shake hands with the little kids. They'd all grin and laugh because they thought I was silly. But what's my purpose? My purpose is I am respecting you. I see you. I see you. You're not just a chair up against the wall. We'll come back to that. Let me say a real quick word about Lean Six Sigma. I won't spend a lot of time on this, but those of you who are very process oriented, and much of this has come from institutions like airlines industry and others that have to get everything right, and if they don't get everything right, if they make mistakes or things don't go right, they all die many times along with the patient. Big incentive, right? Different from healthcare, where you say, well, he was 900 years old and blah, 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 and blah, blah, blah. But if you're on that same plane, right? You're on that same plane, you don't need a bigger incentive. One of the most important, I think, one of the most excellent systems is Lean Six Sigma. Lean, real quickly, just means eliminating waste. Eliminating waste. Would you guess is one of the biggest wastes when you go to the hospital or go to see the doctor? What's one of the biggest wastes? Something that should not happen, you think? What are those rooms that you sit in? Waiting room. Waiting. Why do you have to wait? What dictionary is that in? Who says that you got to wait 2 hours before your doctor sees you when you go to her office? Where is that written? That you have to wait 2 hours. But one of the things that I used to do in my office, and my office manager is sitting right in front of me. She ran not only me, but my office. We had a policy. True story. We had a policy in my office. If you had a 1 o'clock appointment to see me, but you arrived at 12:30, we would see you at 12:30 because we were already there 30 or an hour before your appointment time, right? Because we schedule appointments. We know what time you're supposed to come in. And we would see you because the idea being, number one, to show respect. My time is valuable, so is your time. But why should you have to wait for me? Why should I have to wait for you? Mutual respect, okay? So lean eliminates waste. What Six Sigma does is Six Sigma eliminates variation. If there are 6 of us, 7 of us in this room, and we all want to get out that door, but we all want to get out of this room, but we come up with 7 different ways to do it. Some go out the door, some go out this door, some go out the window, some go out this other way. That's really pretty inefficient, wouldn't you say? Now multiply that in a huge hospital delivery system, 1,000 beds with 1,000 plus patients. So to have efficiency, to not make mistakes, you need to have a simple but effective process. And that's what Six Sigma does, right? Six Sigma says, I would be on rounds in a hospital, say in Chicago, and they would be presenting to me about something they're very proud of. And they say, we decreased our infection rate from 80%. We improved our efficiency up to 80%, 85%. And nobody in the area has hit 85%. True story. And I was saying, it's very good. I said, but why not 90? They said, well, nobody does 90. I said, I'm not talking about all those other people. You're the superstar. I said, well, why not 95? Why not 100? When did we decide that 80% was excellent? Who wrote that dictionary? And then I would tell them true story. I said, because if I'm a patient in your hospital, or my wife, or my children, or my grandchildren, I want 100%. I'm not impressed with the 85%. Good job, but I expect you to do more. I expect you. Six Sigma, to break it down mathematically, says 99.999666. That distance between 99% and 100, you can do better. That makes sense? Six Sigma says you need to be not at 85%, you need to be at 99, but even at 99, you can do better before you get to 100. In essence, you never stop improving. There's always something better that you can do. And that's actually been articulated. And I would encourage you to take that handheld computer that you have and look up Lean Six Sigma. Real quickly, this is just the roadmap for it. Define, measure, analyze, improve, control. I'll just say a quick word about define. Whenever there's a problem, a system, let's say Dr. McClure is the owner of a small hospital, 250 beds. In his hospital, he has an OB/GYN department for delivering babies. He has an emergency department where patients come in if they have emergencies. One of his managers comes to him and he says, Dr. McClure, we have a problem. And he says, well, what's your problem? And she says, well, we have a lot of people who come to our emergency room, but they leave before they see the doctor. They leave before they see the doctor. We call it left without being seen. Okay? Leave before they see the doctor. So he says, why are they leaving before they see the doctor? She says, I don't know. She said, but it's a problem. She said, because we have all these people tied up, and more importantly, we aren't doing anything for the community. So what are some of the reasons they can be leaving without seeing the doctor? Well, maybe they have to wait too long to see the doctor. If they have to wait 6 hours, 10 hours, would you leave? Your mother, you bring your kid in because he has an ear infection. You got to go to work the next morning. You bring the kid in at 10 o'clock at night, and you wait 8 hours in an emergency room before taking him, before having him seen. So is it waiting too long? Is it they feel uncomfortable in your emergency room? Maybe it's not clean. Maybe there's a lot of activity, and they don't feel safe in the emergency room. Maybe they've seen your doctors walk around the emergency room, and they're wearing flip-flops and shorts, and you said, "Whoa, am I in the right place?" So what's my point? My point is, for those of you who are math enthusiasts, there's a formula for Lean Six Sigma. It says Y equals a function of X. Y is your problem. Y is what you're trying to solve. Y is what you've got to fix. X are the number of reasons that are causing your problems, but you don't know which one it is. Let's say you have 5 X's. 1, you have to wait too long. 2, your emergency room is dirty. 3, they don't like the way your doctors look. On and on and on and on and on. Lean Six Sigma helps you identify which X you need to fix, basically. And one final thing about define, whenever there's a problem in any organization or something has happened and people, we got to fix that. First thing that happens when you have a meeting, everybody comes up with a solution. Well, I think we should do this and this. And somebody says, well, I think you should do E, F, G. And somebody says, well, I think you should do A and B. Albert Einstein once said, and I always remember this, when I have a problem, and I've said this before, when I have a problem, I spend, and I have an hour to fix it. I spend 55 minutes defining the problem and 5 minutes solving the problem. What's my point? Most of the things that will help you solve a problem is sitting down and talking about it. Defining what do you mean when you say left without being seen? What do you mean? Blah, blah, blah. You would be amazed at how much miscommunication occurs because we say things, but everybody has different meanings, but we never ask. Okay? That's what the roadmap looks like with Lean Six Sigma. Again, use your hand computer to look up Lean Six Sigma. Okay, medical malpractice. So I'm just about done, right? Right. You've been following me, right? I'm just about done. So what is medical malpractice? Now, I have been asking you for the last 5 months to think like doctors. I'm now going to ask you to think like lawyers. Forget about being a doctor. You're now an attorney. You're now attorneys. We're dealing with the Andrew Collins, Hammond's, Jesse Hammond's law practice. They are famous around the area, particularly medical malpractice. So they're the top of the line. And I, one of the things I learned is that, people tend to like doctors in general. People don't tend to like lawyers in general. I'm just, generalizing now. But somebody once said people tend to hate lawyers until you need one. You need one. When you need one, you need a good one. And one of the things that I learned when I went to law school was how little I knew about the law. And the reason for that is the law is deceptively complex. You read a line that says, use a gun, go to prison. And you say, well, I understand that. I know what a gun is. I know what prison is. I know what use a gun, go to prison. I know what that means. But that's not necessarily true. That's not necessarily true. And I can tell you, when I went to law school, I was older than the other students. They were 20-somethings. I was 40-something, whatever, 40 or 50-something. And one of my favorite classes was tort, T-O-R-T. And tort means injury. Okay, and that's connected to our subject. And I was sitting now, you got to say, I'm one of those students who gets a class an hour or 30 minutes ahead of time. I sit in the front row. Okay, I mean, you know the type. I got my pencils and my pen. You see them. Come on. I'm that type of student. All right. So you get the picture. So I'm sitting in the front row, ready. Uh, and the instructor gets up and says, man walks up to another man, takes a gun, puts it to his head, pulls the trigger, shoots him in the head. Man drops and he's dead. Is that murder? And I jump up and I'm throwing my hand up. I'm on the front row, throwing my hand up, and he's left. And he said, Dr. Choctaw. I said, yes, it's murder. And the instructor looked at me and he says, it depends. And I said, what do you mean it depends? You just told me that the guy walked up, put the gun to his head, pulled the trigger, the guy was dead. He said, was it his house? I said, I don't know. He said, what was the man doing when the guy shot him? I said, I don't know. He said, was the man coming at him? Did he have a gun also? I said, I don't know. What the instructor was telling me is, it does depend. You've got to know the fact before you come to a conclusion. Grayness, it is not black and white. I'm a doctor. Not only I'm a surgeon, we really are black and white. Give me a knife. I'll find out what the problem is. Right? No. Lawyers don't get knives. No. And so whenever you ask an attorney, and I encourage you to take me up on this, any attorney, ask him or her a question. And I guarantee you the first thing she will say to you, or he will say to you, it depends. First thing they will say, they'll say two words, it depends. Because what they're saying is, you got to give me more information. You got to give me more information. You can't just tell me somebody got shot and expect me to come to a conclusion and not give me anything to work with. So that's the fundamental difference between medicine and law, right? I would tell members of my hospital when I was chief of staff, and they would bring to me a situation, let's say harassment of some type. And they would say, oh, it's terrible, it's this, and we need to do A, B, and C. And I would say, have you talked to the other party? Do you have the other side of one of the things I learned in law school, if I did not know it before, there are always two sides. Always, always, always. I don't care if the guy put the gun to the guy's head and shot, just like I was saying. What were the circumstances around that? What was the guy holding the guy's family hostage? Don't know. I don't know. So my point is, and I really believe this is where the law helped me personally. I have, for the most part, always been a black and white type of guy, blah, 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 blah. But what I have learned is to take a step back, ask a few more questions. Don't be so quick to judge. Don't be so quick to think I have the answer, because many times I'm wrong, and I don't want to be wrong. Does that make sense? So my point is that regardless of what you think about lawyers, one of the things that the law does is that it makes you slow down and get all the facts, because you don't want to be wrong. Whatever conclusion you come to, you want it to be the right conclusion. All right? So just keep that in mind. Okay, let's go. So tort is a type of law that means injury, T-O-R-T. There are two main big sections of the law. There's criminal and there's civil. All right, criminal and civil. Malpractice is civil law. It is not criminal. Let me explain the difference. If I am found in violation of a civil statute, basically I pay money. I have injured somebody, or I have created an injury, and to make that person whole, I have to compensate them for their injury. Okay? If, on the other hand, I am found guilty of a criminal statute, I go to jail. Think about that. Civil, you pay money. Criminal, you go to jail. Civil, somebody will sue me, or some entity will sue me, and blah, 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 blah. You defamed me, you violated this, or whatever. But if it's criminal, the district attorney of the state of California will say, representing the citizens of the state of California, because my crime is considered a violation of the state. I violated all the members of the state of California. And that's my other point. Medical malpractice is a state law. It is not a federal law. That's why it may vary from state to state to state. Texas may be a little different from California, but the basic parts of it, though, is the same. What is the definition? Going back to what was said before about defining, what is the definition of medical malpractice? The definition is acting unreasonably under the circumstances. Acting unreasonably under the circumstances. There are three elements to that definition. Three elements, only three. Element number one, acting. You got to do something. You got to do something. Number two, unreasonably. What you did was not reasonable. And third element, under the circumstances. Let me give you an idea. Let's say a patient comes into the emergency room as part of a 50-car pileup on the freeway, and the patient comes in, and the emergency room is just a big scramble. And they call it down the trauma surgeons, and we come down, and we're taking different patients, and blah 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 and blah blah blah. Let's say one of the surgeons at the end of the operation, the scar of the surgery is longer than it normally would be. Let's just say for the sake of argument. And the patient decides to sue the surgeon because she didn't like the way her scar looked. Surgeon's attorney will say, there were 50 people in that emergency room. Dr. McClure was operating on 25 of them by himself because he's a super doctor. All right. So if the scar on patient number 10 was a little longer than patient number 11, under those circumstances, that's really okay. That's not a big deal, right? Okay. So it's important to understand the definition. You got to do something. Let's say you are at a meeting. Say you're at church, and someone comes up and says, I've got this blah, 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 and I've been taking medicine A or medicine B, and I'm thinking about throwing out medicine A and just taking medicine B. Do you think that's okay, Dr. X? So what should Dr. X do? True. Number one, should not answer the question, but at the very minimum is to say, I don't have enough information, which is true. One of the things I used to tell the young doctors coming out, don't make telephone diagnoses. People will call you up and say, I just woke up and I got this pain that's on the right side and it's going around to the this and to the that. Do you think I need to go see the doctor or just wait until morning? And I would say, do the safest thing, and that's probably go into the emergency room because you don't know. You don't have a clue. You don't have a clue. Now, this is based on what's reasonable for the reasonable physician. The standard is not the reasonable person. The standard is the reasonable physician. So what they will do is that they will call in an expert doctor, Dr. Rivas, and say, Dr. Rivas, we want you to review this record because there's been a concern about Dr. X, and we want to make sure that you think that he did or did not operate reasonably under the circumstances. Okay. So there are four elements that plaintiff's counsel has to prove to find you liable for malpractice. Did you have a duty to the patient? Did you have a duty to the patient? Now, if the patient came into your office and you touched them, then you have a duty. If you saw the patient in the emergency room and you touched them, you have a duty. Let's say you're at a dinner party and you're all drinking your sodas. Sodas. Coke, Pepsi, whichever you like. You guys are sharp. You didn't miss that a bit. And you're drinking your sodas, and someone asks you for advice. Do you have a duty to that patient? Probably not. So my point is, you got to have a duty to the patient. Did you breach your duty to the patient? Second element. Breach means, did you violate that duty? That's why you call in the expert witness to review the record. There's going to be another doctor to say, yeah, he did or did not breach your duty. Did your breach cause damages? And indeed, were there damages? So the four elements the claims counsel has to prove before you can be found liable for medical malpractice. Now, if you are inclined to find out more about this subject, there's an expert notes. What are the things that when I would give talks to doctors, and I would give basically the same talk to the docs. There are certain things I would tell them, and I'll summarize it like this. That I would tell them, most patients will forgive you, even if you make a mistake. They will. I'm telling you, they will. After 50 years of practice, they will. Most people will forgive you. They'll say, doctor, blah, 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 whatever. And they won't even think about malpractice or suit. But there's one exception. And that exception is if you're a jerk. If you are a jerk, J-E-R-K, they will not forgive you. If you walk into the room and wife is the patient, husband standing in the corner, you ignore him, you just talk to her, you just ignore him, or the family or the grandparents or whatever, I'm just making this up. You ignore them in the room, you're disrespectful. One of the hypotheticals I used to use in my presentation to the doc is, patient comes to see the doctor, patient's said to be Spanish speaking only. Nurse gives a chart to the doctor, and as the nurse is handing the chart to the doctor, nurse says, Spanish speaking only. Doctor says, okay. Doctor doesn't speak Spanish. Puts the patient in the room. Doctor goes into the patient's room with the nurse who interprets for him, and does his exam and history and all that sort of stuff, writes a prescription for the patient, okay? And before the doctor leaves the room, he turns to the nurse and makes a comment about the patient. Quick comment, real quick comment, but it's sort of a disparaging type of comment. Not anything rude, but it's not nice. It's not a nice comment. I'll put it like that. And one of the things that I always tell the docs, I said, I don't care what the language is, and I don't care what the nurse tells you. I don't care what language they say the patient speaks or the patient speaks. Everybody who is said to be Spanish speaking, and you can fill in the blank with Spanish. You can put in Tagalog, Mandarin, Cantonese, on and on and on and on. Speak some English. So you do not have to speak the language to communicate pro or con to the patient. I said, so don't make stupid mistakes, right? I mean, in my mind, that's a stupid mistake or whatever, but there's no excuse for that. And it goes back to respect transcends all culture. Be respectful. Just be respectful. Same thing your mother and father taught you when you were growing up. Be respectful. So I would always end my my presentation with the docs by saying, don't be a jerk. Real easy to remember. Just don't be a jerk. In summary, transformation in healthcare is patient-centered. Obama was a landmark healthcare legislation. Hospitals are achieving high reliability with Lean Six Sigma and similar types of processes. Respect transcends all culture. And avoid medical malpractice by not being a jerk. My basic principles, as I always like to end up, God is in charge. I don't have bad days. Don't sweat the small stuff, and most stuff is small. Forgiveness really is therapy. And everything is a relationship. Mutual respect, mutual trust, good communication. Are there any questions? Yes, sir.
Yes. When you were talking, when you were talking about you seeing things black and white, and the way, let's say if I'm your patient, are you nice with me because of the way you think, or because of the privilege that I have or the law?
Excellent question. I am nice with you because you're a human being. And that's basic. That's all you need is just to be human. And all that other stuff, I completely ignore. Go ahead.
So there is no law, in other words, that will tell you to respect the other
There
person.
is a law. There is a law, and that's an excellent question. I'll tell you why. Because what we know is there are laws, and then there's how you interpret. There is a law that says I need to treat you reasonably and responsibly. But a lot of times individuals can sort of can do what they want to do and sort of get around the law. But yes, there are rules that say I'm supposed to treat you a certain way, you know. But a lot of that depends on whether I think I can get away with it or whether I think you will tell somebody, et cetera, et cetera. But the right way is it shouldn't matter that my approach should be the same as it is with everybody else, and that is with absolute respect.
And just to finish it up, this
Yes.
is not a question. Well,
That's
it
okay.
is a question.
That's okay.
When I went to the office, the doctor's office,
Hmm.
I saw a sign
Okay.
that said, "Don't tell me what you Google on
Really?
your
Oh my
on
God.
your symptoms."
Oh my God. Okay.
So why is that a problem? Well, what is that?
Okay. I would consider that rude if I were a parent. Because what he or she is saying is, I don't want to listen to you. But the reality is, and I think this is a good reality. Yeah, there are bad things about the internet or AI, whatever, whatever. But I think the good thing about it is that it's empowering patients. It used to be that we control all the information, but now you can do a chatbot or you can go online and you can look up anything that I tell you. So what I would way I would interpret that is that they aren't interested in listening to me. They just want to tell me what they want to tell me. And I would for me that would be a non-starter. I go to another doctor because I want to have a discussion. Now, if I'm just a patient, I'm not a doctor. I at least want you to be able to explain to me what it is you're going to do in plain English. Don't use all those big words to try to impress me in plain English. And just like that HCAP question, that I can understand. So it's the patient's perspective, not the doctor's perspective. And if someone was affirmatively putting stuff on the door, saying, don't even come in if you want me to ask a question, I'd pass them by. Because I would consider them rude. I would consider them, and they're already telling me that they don't want to talk to me. They just want to tell me what to do. And I'm not interested in that kind of thing. If I have the option, I'd pass them by. I'm saying, yes, sir. Please go ahead, Gary. Oh, can you hear me? Oh,
Yes, I had a question about what's the word? So if there's a question of malpractice or anything like that,
okay.
What is the statute of limitations as far as time period?
I think that's a good question. I think it's about, because it varies per state. I want to say it's like a couple of years, but that would be a good thing to put into Google and say malpractice statute of limitation, and they can tell you exactly. But I think it's at least probably about a couple of years.
Okay, and the B part to that is how would you then, if you do have a suspicion, how would you then acquire the information as far as what happened or what took place?
Excellent question. Excellent question. I think the first thing you would do is that you want to talk to an attorney. So then the question is, well, how do you find an attorney? There are a couple of ways to do that. One is if you know friends, who know an attorney, but be honest with you, most people don't, quite honestly. And what I would do is I would go back to the search and I would put in a medical malpractice attorneys near me. Medical malpractice attorneys near me. I would call them up and I would say, I need a consultation on a possible malpractice case. Most of the times they'll give you a consultation about 30 minutes, 45 minutes, and ask what their fee is. And then you can shop around to make sure that fee is compatible with what you're willing to pay and go in and talk to somebody, because what you want to do is you want to present the facts and have them use their legal expertise to let you know, is there anything there or not? And for a lot of people, just doing that is therapeutic. A lot of people are not interested in that, but they have a question. They're uncomfortable. They say, I'm not sure. And just getting legal advice sometimes is worth it. But that's the way I would do it.
So does the hospital do you have a right to information as far as that, as far as a release of information from the hospital or doctor?
You say information about the hospital and about the doctor from the hospital?
Yeah, as far as your possible question, as far as what happened in a particular situation, does the hospital have a right to release information to you based on that situation?
Okay. The hospital has right to release your information. If you say, I want my medical records, or let's say if it's a child, I want my child's medical records, that's within your right. The hospital's not going to tell you much else other than that, because they have their own attorneys and the physicians have their own attorneys. Now, you bring up a good point that I think is important to emphasize. Every hospital has a complaint department. If you have a concern, you can put it in very general terms and say, I was in the hospital, blah, 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 or my family member, blah, 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 and we didn't understand why blah, blah, blah happened. Please explain. You can write a very generic letter like that. The important thing is that when you do a complaint, it has to be in writing. Most people don't know that. You can't just call up and talk to somebody. You have to put it in writing. And one of the things that we used to do when we would evaluate accreditation of hospitals is how they deal with complaints in writing. They have a time frame that they have to answer you specifically. So put it in writing. It doesn't have to be very long. And say, we have some questions about our case. We want more information. Smart hospitals will be very happy to talk to you about
it. Thank you.
You're welcome. Any other questions? Yes.
Yeah. Regarding that usually if somebody calls in, they have some symptoms, and not to give, what is it, you tell them, go to the medical or go see a doctor. And now, sometimes when you want to make an appointment at the hospital, they say, well, we can give you online at a certain time if you want to know what's wrong with you. Is that something that is going to be, or is that something that is just at a hospital?
Well, that's something that's happening right now, and that's fine. Because what's happened is that now doctor-patient hospital interaction can be virtual or in person. That is perfectly okay. Where you put in your basic symptoms, and then they'll ask you some questions. And what they're doing is they're trying to decide, is this something they need to have you come in for, or is this something that they can answer for you online? That's the best way to do it, quite honestly. Absolutely. Absolutely. Yes, Lorraine?
Just a suggestion that they can also
Excellent point. Excellent point. If it's sort of like a relationship that's about to go bad in a way, you see what I'm saying? I'm talking about doctor-patient now. It is reasonable to say, doctor, we have a lot of questions about what happened to my uncle, that you took care of. It is smart to ask to meet with the physician for a number of reasons. If he says no, that you want to make a note of, okay? But a lot of times, to Lorena's point, this can be resolved just with a quick conversation. Most of the times, there are questions that have not been answered or have not been answered completely. And just by getting those things answered, all that stuff can go away. I would argue more than 50% of the time, it can go away if that physician is willing to talk. Because the physician, in my opinion, is more important than the hospital. Unless it's a hospital-related employee, even then, I would still start with the physician. Because you want to get that physician on your side. If the physician says, oh, you're exactly right, there's no way, blah, 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 I should have done that, then that's important for you to know. But excellent point. You want to have that meeting first. Because a lot of times the hospital will put together a team to meet with you. But it's always better to have the meeting first. Absolutely. Yes, sir. Do you have a question? I thought you. Any other questions? Yes, sir.
Yes, Doctor.
Oh, go ahead.
Go ahead.
Brother Sukram?
I'm sorry. I was going to ask.
Okay.
So if you have a current doctor that you're not exactly gelling with, right? So let's say like you feel like their office is always like in a rush, your appointment is kind of rushed through and stuff like that. How do you go about getting another doctor as far as okay, so you know you call your insurance, you get a list or whatever, blah blah. Are there certain questions that you should ask those doctors when choosing a doctor, or what would you say is the best process of doing that?
I personally think the best process of doing that is actually being there physically if you can, because I think you're going to pick up some things that may not come up in a normal question. You're going to look around the office. Is it clean? Or are there a lot of people? Are there few people? You know, that yeah, you can certainly still ask questions, you know, in terms of what their experience is. Let's say if it's a procedure or whatever, you can ask some basic questions. But I think if possible, making eye contact, doing that person-to-person type of thing is worth doing. One of the things that my wife and I do, we tend to do things differently sometimes. So I'd like to always have her with me or vice versa, because she's going to pick up stuff that I'm going to miss, or I may pick up stuff that she missed. So I'm a big believer, if possible now, to have that in-person type of thing. If not, you can certainly ask certain basic things about procedures in terms of how that person explains things to you, or if they're even willing to talk to you. All those things are things that you can sort of check the boxes in terms of pro or con. Pro leaders. The other question.
Yes, I think I'm one of those persons that you said that I think the physicians they're always busy, and unless I don't see some openness, I won't even ask about what I went for. just waiting for them to tell me. But you're a doctor over here, and we usually tend. Well, I'm usually tend. You know, oh, he's a doctor, and he's not a simple doctor. I mean, he's a surgeon. Oh man, I have it with me. So when we approach to you, if we do, and we engage, you know, in a term of a conversation, do you duty to that person under the regulations, medical regulations?
Oh, I see. Okay. It depends. Let's not put that other hat on. No, it does, because it depends what the service are. Are you in my office? You know, or are we in the, are we?
No, we're here in the parking lot.
Oh, in the parking lot. Okay. Yeah, in the parking lot, then there's probably no obligation. But I'm going to go back to your original comment also. In terms of, because a lot of, I would say 50%, if not more, people are exactly like you. I would write down the question, because what that does, that helps to slow you down. You know, you can just say, I just have a couple questions and I wrote them down. Is that okay? And you just go down your list. That way you don't have to worry about getting flustered and trying to remember and all. Well, you just write down 2 or 3 questions that you have. Now, if it's at a social event, many times the doctor is not obligated to say anything, but that's on her, what she says or doesn't say. And what I do, I always reply, because I think it's rude not to, you know, type thing. You know what I mean? But just say, well, I'm not sure, or refer. I use just refer, you know, to the primary doctor.
Because there are persons. I mean, I work for the medical team management department in the hospital. There are people who know who they're looking for.
Yes.
A gap just to get.
Yeah.
Or just to get that person or that hospital.
Yes.
This thing.
There's no question that if one has an addiction, then a lot of it is intentional, you know, where they're strategizing and that sort of thing. That I view them as a subset as compared to just a regular patient. But having said that, one of the things that we docs have to be careful of is assuming that one is acting a certain way because of an addiction. And one of the things I used to say, drug addicts have pain too. You know, they have real pain too. You know, and just because I'm you know, one is a drug addict doesn't mean it doesn't hurt. You know, and so we have to make that separation, because it's very easy. And I've seen this in the hospitals a lot. Oh, so and so is a blah 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 blah. It doesn't really hurt. Doesn't really hurt. Of course it hurts. Of course it hurts. And I'll end on this. The whole thing about healthcare disparities is where we look at people a certain way and then come to conclusions about them based on how they look. It has nothing to do with science, just based on how they look. And that's like the worst form of healthcare disparities. But there's no question, there are people who are manipulative, usually addicts, people who know the system, know it very well, have been doing it for years, and know how to work the system. Most of them are going to be in the minority. Exception might be a drug addiction clinic where addiction is the primary issue. Yes.
Can you expand a little bit about how a person can make their malpractice, how they can go through their insurance company and request a referral to the physician and explain it?
That's an excellent point. Thank you. One of the things that we all know is that it doesn't always work. It just nobody's fault, not the doctor's fault, it's not the patient's fault. Your insurance company can certainly help you with that. Just say, well, I went to see Dr. Choctaw, but I think I want to go see Dr. Collin. He just seems to be a nicer guy, and he has a pretty watch, and I just think I want to go see him. And many times your insurance company will accommodate you because remember, it's patient-centered now, to Lorena's point. 50 years ago, they'd say, tough, Choctaw's all you have. But now you do have that leverage. And I would clearly I encourage you to say, if it's just us or whatever, we just want to get a second opinion. But you want to explore that. You don't want to be uncomfortable all the way through when you're going into healthcare. And from day one, it's not working. You're not communicating. You don't trust. The trust's not there. Whatever. You don't have the feeling. Whatever that is. Then you want to get out of there before it even starts. Because it's not going to get better. Yes.
Yeah, I was able to do that.
Okay. And how did you do it?
Online and look for the doctor they had what I needed.
Okay.
To see, and I was able to change it.
Okay.
I had picked it up first.
Right.
But then it was not enough, so I went online and looked for someone else, and best thing I could do.
There you go. Yeah. And that's an excellent point. That you have power, which is the whole point. And part of your power is that you can say no, just like we talked about one of the other lectures. And part of your power is you can say, I want another opinion or whatever. But I would encourage you to do that. And it doesn't mean you're a bad person. It doesn't mean the doctor's a bad person. It just means it's not working. Nobody has to be at fault, but you have the authority to change that. Okay.
Yeah.
All right. Thank you. Thank you very much. Have a great week and happy Mother's Day to all the mothers.
Thanks for listening to the Healthy, Wealthy, and Wise podcast with Dr. William Choctaw. We hope you enjoyed this episode on healthcare's quality revolution. And if you found this episode helpful, please subscribe to the podcast on your favorite podcast platform. This will help ensure that you don't miss any future episodes. And then share it with your family, friends, and or your co-workers. They'll thank you for it. And we thank you once again for listening to the Healthy, Wealthy, and Wise podcast with Dr. William Choctaw. Live your best life the best way.